Dear ladies and gentlemen, it's a great honor to be here for this very special occasion, your anniversary, 110 years. Het is een heel groot, bijzonder genoegen voor mij om hier te zijn in Brussel. Het heeft een speciale plek in mijn hart. Mijn vrouw is Belgisch, komt niet uit West-Vlaanderen, maar uit Ukkel. En ik kom uit Maastricht en dan ben je eigenlijk ook een halve Belg. Omdat ik niet zo in Frans kan spreken, switch ik het met Engels. So, I would like to invite you for a mental exercise. But before we embark on that, I would first like to give a brief introduction to what ECDC does, because I'm not sure that everyone is familiar with that. The European Centre for Disease Prevention and Control was established in 2005 in Stockholm. The responsibility is to strengthen Europe's defenses against infectious diseases. And our official mission is to identify, to assess and communicate the current and emerging threats to human health posed by infectious diseases. And as one of you has asked me, are you in charge of the control of infectious diseases, taking measures? The answer is no, we are not. That is a national responsibility, or maybe in Belgium it's even a gemeenschapsverantwoordelijkheid. And of course the Commission has a very important role in that respect. So our core business is risk assessment and to provide the politicians with options. We have to be very vigilant, effective because a lot depends on how we see infectious diseases. Now, our scientific work is very closely linked with that of the national health ministries and the national public health institutes in every country, and we have a very close collaboration, and in fact we have daily contact with a lot of you. We built on a very well-coordinated public health and alert system, and that is working because you are doing that. Now we try to connect all the dots. Now the work of ECDC relies on rigorous independent scientific evidence and analysis, as well as the capacity to take quick and decisive action in order to get a good risk assessment. ECDC is not a political organization. We are a technical organization. I think it's exactly the same with the WIV-Institute. And our role is to provide information for the Commission, especially DG Sanco, the European Parliament, the policymakers, and of course at a national level. Now it's time to invite you for this mental exercise. Let's pretend it's not 2014, but it's 2024. And it's not the 110th anniversary, but the 120th anniversary. And that you have invited me again. I don't know whether that will happen, but let's assume. It's a very great honor for me to be here again for your 120th anniversary. And it's truly fantastic to enter this new state-of-the-art building here. And I remember, I think it was downtown in Brussels, all the other buildings scattered in the city. And now it's amazing. It's a fantastic site here. And I see it's in a beautiful landscape, maybe not this side, but another side. And paperless offices, open space offices, and I see a lot of inspired staff. Now, back to business. Maybe I could use this opportunity to look back at what has happened over the past 10 years. At that time, I was director of ECDC, and in that capacity, I was participant of what I would like to call the European project. There were several citizens who, at that time, were very critical about Europe. I think they were called Eurosceptics. And in fact, in 2014, there was an election of the European Parliament. And the number of EU skeptics elected to the Parliament has increased considerable. At that time, I had many American friends, I still have. But they wanted me to explain this EU. And I always said that you could not compare the European Union to the USA, since their history was in this respect much, much longer. At that time, when I was director of ECDC with a staff of 350, compared to the 15,000 of the US CDC in Atlanta, but nevertheless, many things has changed since then. And of course, the EU discussions at the time also had consequences on the national situation, and in particular the National Institutes for Public Health. And around the year of 2014, I was every month visiting a National Institute of Public Health in the EU member state. And I was always surprised by the diversity of the institutes. And not only did they differ in size, I have seen 20 staff, but also 2,000 staff members, but also in their mandate and the scope. I remember that when I was invited to visit your National Institute back then, I was impressed by the size, the broad scope of your institute, and the high quality, and also the very good quality assurance system. Nevertheless, at that time, there were two pending issues. Some differences between the taalgemeenschappen in your country and discussions regarding the budget of the institute. Now, the good news is that there was a keen interest in health issues at the communitarian level. The less good news was that several of the functions could only be executed at a national or EU level because of costs and because of the expertise or methodology that is required. Now, regarding the budget, I would like to refresh your memory that there were strong views on what was called at that time valorization of knowledge and market competition. You remember market competition. However, after several years, it became clear that public health is an important value for citizens and should be taken care of by a national government. Nowadays, we see that most of the governments in the EU provide a solid budget for the National Institutes of Public Health. And at the same time, these governments called upon cost efficiency at the EU level. I remember that your director at that time had a clear vision on this. There should be a strong national public health institute serving the different communities of Belgium, and it should have a strong European profile in order to be competitive as a European center of excellence. Now, looking around, my impression is that you have succeeded in this. Between 2015 and 2020, there was a fundamental debate in the European Parliament and the Member States. After this so-called Eurosceptic intermezzo between 2012 and 2017, the EU citizens and parliamentarians started paying more attention to public health, also strongly fueled and stimulated by the WHO. Of course, the question was how we could improve public health in Europe, and how does this affect the current structures. In 2015, an important committee was established in order to develop a proposal on how to strengthen public health in the EU and what would be the appropriate infrastructure. To nobody's surprise, this committee advised that it was important to go beyond infectious diseases at a European level. And of course, at the time, the new serious cross-border health threat legislation was an important milestone for the EU that became into effect in November 2013. And from a public health perspective, infectious diseases are important, However, the burden of disease is highest in non-communicable diseases. Moreover, it's also advocated by the Belgian Institute for Public Health, that's you. It was recognized that public health improvements depend strongly on joint approaches and techniques. And as there was less reason to keep the communicable and non-communicable diseases as separate issues, this important committee advised that the European Centre for Disease Prevention and Control should enter a second phase, namely paying attention to the health metrics and best practices of prevention of NCDs. Now, after several debates, the European Parliament, Council and Commission fully supported this idea and were willing to enlarge the staff and budget of ECDC in order to make this possible. Nevertheless, this was not the only recommendation of this important committee. They also reviewed the European capacity of the national public health institutes and were surprised by the diversity of the institutes. From an economic perspective, they advised to establish more European collaboration and, in fact, to establish a European public health infrastructure where ECDC played a coordinating role. And contrary to CDC, in Atlanta of the USA, they were not in favor of a big institute in Stockholm, but advocated better coordination of the existing public health infrastructures in Europe. Hence, a new committee was established with the aim to develop, in close collaboration with ECDC, proposals in order to improve the European public health infrastructure. Now, I would like to look back at the threats of the past 10 years. 10 years ago, we were very concerned about antimicrobial resistance. I still remember a presentation of Mr. de Coster at that time. Yes, I could understand your French. We promoted, from ECDC side, prudent use and development of new antibiotics and to find new business models for the new antibiotics. I know that Belgium has done a lot regarding the prudent use of antibiotics and has set up a system for antimicrobial resistance. And I would like to remind that Professor Herman Goossens played a very important role, and I know that also in your government you paid a lot of attention to this. Now people are much more aware of the limitations regarding antimicrobials. There is a very good collaboration between the national institutes, the EMA, London, EFSA and ECDC. And finally, the use of antibiotics in the vet sector has been reduced dramatically. By the way, did you know that Belgium was one of the first who really paid attention to nosocomial infections? And I was very happy that Carl Sutens, maybe you know him, moved from Belgium to ECDC. And he's now a leading figure in our agency. Still today, influenza poses a threat. There are several new types of influenza and we need to be very vigilant. We have set up a very good EU virus surveillance system and are making use of social media in order to estimate the impact. And again, I would like to remind the important work done in Belgium with the Sentinel stations. And again, you know, René Snakkens, who played a very important role, moved again to Stockholm. So the reference lab system of WHO has further been strengthened. The collaboration in the food and waterborne diseases area has also been improved. At a European level, we are now able to trace and track the causes of infectious diseases. Excellent collaboration between EFSA and ECDC under the leadership of the Commission was key to this success. Now, TB was also a very great concern 10 years ago. There were countries with high incidence and modern big cities with clusters of high TB activity. The great news is that this is now under control. We have paid much more attention in order to support the less rich countries in their fight against TB. We have established a good lab network where all materials from patients are cultured and tested for resistance. And at the European level, we have found a way to support the countries that have difficulties in purchasing the anti-TB drugs. And nowadays in EU, there is no patient who does not have access to the appropriate drugs. At ECDC, we are able to follow the developments because we receive the microbial information from all patients as well as the patient outcome information. 10 years ago, we experienced major outbreaks of measles in Europe, despite the WHO resolution to eliminate measles and rubella by 2015. Now, the good news is that in 2024, we have succeeded in eliminating measles and rubella by concerted actions, and thanks to the commitment of the Commission and the Member States. ECDC has developed different models for the Member States and the public health in order to use a national strategy. Though there is no universal approach in EU, every Member State was able to develop its own tailor-made approach, which turned out to be effective. And 10 years ago, every Member State had its own advisory committee for the national immunization programs. Today, all the national institutes of public health contribute to an EU advisory committee. ECDC has set up, in collaboration with EMA, a public health advisory committee in order to provide and advise the Commission and the Member States. Now, despite the limited capacity of ECDC, it's able to attract top experts from the national institutes, especially from Belgium. Last but not least, the regional committee meeting of the WHO Euro under the chairmanship of Daniel Reinders, a new framework for the development of a surveillance of vector-borne diseases was adopted. In a joint effort of the WHO, ECDC and the Public Health Institutes, we were able to develop this surveillance. At ECDC, Wim van Bortel played an important role in this respect. And 10 years ago, we thought that EU in general did not suffer from vector-borne diseases. Today we know that we need to pay attention to both surveillance, control measures, and also behavior of citizens. And of course, infectious diseases do not respect borders in EU. And there are still ongoing debate at EU level about EU member state. However, for ECDC, this is less relevant because at the request of the Commission, we have developed a very good collaboration with our neighborhood countries. In fact, the current activities of ECDC cover also these countries. And I'm in particular proud that Belgium is also supporting some of the less developed national public health institutes in one of our neighborhood countries. And by the way, also some national public health institutes in developing countries. In that respect, Belgium is a very good example of a country that is taking its responsibility. My conclusion for 2024 is that we have succeeded to control infectious diseases in EU and beyond. This was only possible thanks to the full support of the l'Institut Scientifique de Santé Publique. You have provided lab capacity and special expertise. Contrary to 10 years ago, where each national institute tried to cover almost each topic, there is a much better coordination and division of task and laboratory capacity in EU. The vision of the management, your director of the institute, turned out to be right. More focus for WIV in order to become a European Centre of Excellence for several topics. ECDC can only do its work with full and continued support of the European National Institutes of Public Health, like WIV. I still fully support the vision back in 2005 of the European Parliament and Council that we should not build a new cathedral in Stockholm, but rely on the good work of you. Finally, I would like to end by returning to today and to my role as Director of ECDC. I would like to use this opportunity to thank Belgium for the great support of ECDC. In particular, I would like to mention Daniel Reiners. I think he's not here. No, I don't see him. Daniel is one of the most prominent and active members of our management board. I also would like to pay tribute to Herman van Ooyen. I have seen him, yes, and Sophie Quillin, who are very active members of our advisory forum and who participate in numerous projects between WIV en ECDC. En als laatste wil ik graag mijn respect betuigen voor Johan Peters, die dit instituut een hele mooie nieuwe toekomst heeft gegeven. Dank u wel voor uw aandacht.